Hi, mommies. This is Tanya, Noor's mom. So, today I'm going to be speaking to you all about thumb sucking in babies. So, yes, I get a lot of questions that my baby sucking his thumb, what to do, how to get rid of this habit. Please help us. So, here I am to help you understand what's normal and what's not. So, when babies are born, they are born with 7 reflexes, out of which sucking is one. Sucking is a very normal reflex that babies are born with, and that is the reason why they can suck from the breast or the bottle nipple so easily. We don't teach them, they know it themselves. So, that is why sucking is very normal, and because of this sucking reflex, babies tend to suck on their thumbs, or some babies even suck on their fingers. So, uh, thumb sucking is a very natural, normal, and expected behavior out of newborns. In fact, 1 out of 3 babies under 1 year suck their thumbs. So, now why do they suck their thumbs? So, the suckling reflex or the sucking motion or movement actually helps in soothing or calming the baby. That is why when babies are breastfeeding or they're on a pacifier, they're very calm. So, similarly, when they suck their thumbs, it's a very calming, soothing behavior. Sucking provides them comfort. If they are very sleepy or tired, they are scared of something, there's some anxiety. Some babies even suck their thumbs out of boredom because they're bored, they don't have anything to do. So, yes, it basically just helps them calm down. It is also a sign of emotional maturity. So, when the baby is not feeling good, he's distressed, uncomfortable, he's not calling out to you or crying. He is himself calming him down by either sucking his thumb or his pacifier or whatever. So, this concludes that yes, sucking is very normal, and it is just not your baby who is doing this. It's a very common thing. So, when does thumb sucking start? So, thumb sucking can start as early as when the baby is in your womb. Yes. So, when we get those ultrasounds at those last months, we can see some babies sucking their thumbs, right? So, yes, they can start sucking right when they're in the womb, while some babies might start sucking, a few months after birth. So, it's normal. Now, a lot of parents, when they start seeing their children sucking their thumbs, they get very worried that, oh my god, this is going to spoil their teeth, this is going to affect their teeth development, they'll not be able to speak. My family is after me, pressurizing me to remove this habit. So, guys, relax. According to the American Dental Association, if your baby sucks his thumb till 4 years of age, it's okay. It is not going to affect their teeth. Teeth development is affected only when your babies continue this thumb sucking habit after 4 years. That is because around the 4-year mark, the baby's permanent teeth start coming in their gums. They don't come out, but they start developing inside. So, this is the age when, if the child still sucks his thumb, that can hamper the baby's tooth development. So, till 4 years, if your baby is sucking his thumb, it is okay. Don't be worried about it. It will not affect his smile, his teeth, anything. So, but if you don't remove this habit by 4 years of age, then depending on how frequently your baby sucks his thumb, which angle he's sucking in, and how hard he sucks it, it can cause a misalignment of teeth. It can cause, an overbite or underbite problem. So the lower jaw is either protruding like this, or the upper is outside, or it can cause a gap between the upper and lower jaw. It can even cause palate problems. It can cause a deep palate. Then it can also affect speech development. So babies who continue to suck their thumbs after 4 years, they might develop a lisp, or they might have difficulty saying their T's or D's, right? Then prolonged sucking of thumb can also cause skin infection here, and even nail infection. So, sucking of thumb after 4 years is not recommended. It is not good for the child at all. But before 4 years, it's okay. It is normal. So, how do you manage it? So, Once again, according to the American Dental Association, most babies automatically leave this habit between 2 and 4 years of age. You don't have to do anything. They automatically leave it because they start going outside, they become social, they meet their friends in the play school, and that kind of peer pressure that my friends are not sucking their thumbs kind of gets to them, and they automatically leave that habit. So, the only thing you need to do is to not do anything till 4 years. Please don't intervene. Don't force your baby to, continuously get his thumb out. So, what we do is the baby sucking his thumb, and we continuously, get his hand down like this. The more you do this, the more they will suck their thumb, because they feel this is something that I'm not allowed to do, so I have to explore it. So, they are very, very curious, and they want to kind of satisfy their curiosity, right? So do not kind of force them, pressurize them. Please don't punish them. Some parents beat their children, hit them, or try to do things like that. I will not give you food to eat if you continue to suck your thumb. Please don't do that. All of this creates stress, mental anxiety, which can further lead to them continue to sucking their thumb. Also, don't use any aversion techniques, like some people apply neem oil or some bitter nail polish. Please don't do that. There can be chance for toxicity, poisoning, so don't do that. And also, don't pressurize the child too much. Don't keep on telling him this all day long or keep on removing it. The more you do it, the more this process of weaning will get delayed. So the easiest is that till 3 years of age, I would say, don't intervene. Let your child suck his thumb as much as he wants to. Okay, because when when he's given that freedom to suck his thumb, he will automatically get bored of it one day. But if you keep on doing that, he will always feel that there's something I've still not experienced, so I have to do it, and that will further delay the process. So please don't do that, right? Now, when you see your baby, he started sucking his thumb in the first year of his life, a very, very simple thing to avoid the child getting used to that habit is to distract him. So, like I said, babies sometimes suck their thumbs because they have nothing to do, they're bored. So, offer them teethers, pacifiers, toys. So, when the baby is so busy, is distracted somewhere else, he's busy in a toy, he will not get time to even think about putting his thumb inside. This is exactly what I did with Noor. So she started showing these signs around the 4th month mark, and that's the time I introduced teethers to her. So whenever she would do it, I would just give her a teether, and she would get busy in that. Then at the 6th month mark, I introduced a pacifier. So yes, giving a pacifier in the initial months of the baby's life, in order to stop thumb sucking, I feel is a good thing, because it is easier to remove the pacifier habit, because pacifier is a device. It is in your control. When you don't want your child to have it, you can take it away. Okay, he will cry for a day or two, but he'll get okay. But with thumb sucking, baby owns his thumbs. He can suck them whenever he wants to. So you can actually, thumb sucking is a more difficult habit to remove. So offer them teethers, pacifiers. Don't worry, their teeth will not get hampered at all. And always distract them. Offer a toy whenever you think this is happening. But if your baby is older and now you can't really distract him, he knows what he wants, he knows what he wants to do when. So that is the time, then you tread slowly. So like I said, don't pressurize them, number one. Even if they're 1-year-old, 2-year-old or 3-year-old, don't pressurize them. The only thing that works is positive reinforcement or a reward system. So every time your baby does not suck his thumb, make it a big deal. Clap for him, praise him, let everyone in the family do that. Give him like a snack that he likes. Or, so if he doesn't suck his thumb for 2 hours, give him 2 biscuits that he likes. So that will make a connection that when I don't suck my thumb, I will get praise, I'll get encouragement, people will be happy with me, there'll be so much clapping. Or if the baby is even older and he understands, then you can put like a board in his room, and every hour he does not suck his thumb, add a star to it or give him a sticker. So all of that motivates the child, encourages him, right? Then if your baby is around 3 years or 3.5 years, you can talk to them, explain to them that how this is not good, and how he can use other ways to soothe himself. You can give him a soft toy or a good cute looking pillow, right? Also, try to analyze that why your baby is actually sucking his thumb. What is the situation that arises that he sucks his thumb? Is it just before he's sleeping because he wants to sleep, or when he gets hurt, or he's lonely, he has nothing to do? Analyze the situations and try to solve them with him, and give him something else to kind of get distracted towards. Also, if your baby is around 3 4 years old and you're trying to make him leave this habit, then you can apply cute looking band-aids on their thumbs. So you get cute looking band-aids called ouchie. Apply them, so every time they look at it, they get reminded that okay, you don't have to suck your thumb, and they get very involved in the colorful band-aid. So even that works. But if you feel that it is 4 years and above and your baby is still sucking his thumb, then it's a good idea to visit a pediatric dentist, and he might recommend they have this anti thumb sucking guard, uh, or they have other anti thumb sucking devices which don't let the child kind of move his elbow. So you can do all of that, but only if this persists after 4 years. Before that, avoid kind of making this a big deal and pressurizing him. Simple things like reward system, encouragement, talking about it, and just letting him know that how other babies are not doing it, does the job, and most babies will leave it on their own. Don't worry so much, and don't be pressurized. What will my relatives say, or what will my mother-in-law or my parents say? It's okay, every baby is different. We've got to kind of respect the baby also and meet his needs. So if this is his need, then we can let him meet his needs till 4 years by using this. But after 4 years, when we see that this is not going, then we intervene as parents. But yes, so this is all about thumb sucking in babies. It is normal not to be intervened. Hope this video was helpful. Keep writing. Take care. Thank you. Bye bye.